Today, we will be discussing a topic that affects millions of people worldwide: herpes. Herpes is a viral infection that can cause discomfort, embarrassment, and concerns about transmission. In this video, we will dive deep into understanding the symptoms of herpes, the importance of early diagnosis, and how to manage the condition effectively. So, let's get started. 2. What is herpes? Herpes is a common viral infection caused by the herpes simplex virus, HSV. There are two main types of herpes, HSV1 and HSV2. HSV1 is typically associated with oral herpes, causing cold sores or fever blisters around the mouth and on the face. On the other hand, HSV2 is primarily responsible for genital herpes, which causes blisters or sores in the genital area. Herpes is easily transmitted through direct contact with an infected person's skin, saliva, or genital secretions. This can occur during sexual activity, kissing, sharing utensils, or even from a mother to her newborn during childbirth. 3. Common symptoms of herpes. The symptoms of herpes can vary from person to person. While some individuals may experience severe symptoms, others may have mild or no symptoms at all. Here are the most common signs and symptoms of herpes. 1. Cold sores and blisters. The appearance of cold sores or blisters is one of the hallmark symptoms of herpes. These sores can be painful, itchy, and filled with fluid. They typically appear on or around the mouth, HSV1, or on the genitals, HSV2. 2. Itching or tingling sensation. Many individuals with herpes experience an itching or tingling sensation in the affected area before the appearance of blisters. This sensation, known as prodrome, can serve as an early warning sign of an impending outbreak. 3. Flu-like symptoms. Some people may also experience flu-like symptoms during a herpes outbreak. These symptoms can include fever, body aches, swollen lymph nodes, and general malaise. It is important to note that herpes symptoms may not always be present during an outbreak. Some individuals may have silent or asymptomatic herpes, meaning they carry the virus without experiencing visible symptoms. However, even without noticeable symptoms, individuals with herpes can still transmit the virus to others. IV. Early signs of herpes infection. Recognizing the early signs of herpes infection is crucial for prompt diagnosis and treatment. While the appearance of cold sores or blisters is a clear indication of herpes, there are other potential early indicators to be aware of. These include prodrome symptoms such as tingling, burning, or itching in the affected area before the outbreak occurs. By recognizing these early signs, individuals can seek medical advice and begin appropriate treatment sooner. Versus silent or asymptomatic herpes. As mentioned earlier, some individuals may carry the herpes virus without experiencing visible symptoms. This is known as silent or asymptomatic herpes. It is estimated that around 80% of people with HSV2 have no or mild symptoms. While it may seem like a relief to be asymptomatic, it is important to remember that even without visible symptoms, the virus can still be transmitted to others. Therefore, practicing safe sex and disclosure to partners is crucial in preventing the spread of herpes. V. Seeking medical advice. When to see a doctor. If you suspect that you may have herpes, it is important to consult a healthcare professional for accurate diagnosis and personalized advice. While mild cases of herpes can often be managed at home, there are certain situations in which seeking medical advice is necessary. 1. First-time outbreak or uncertain about symptoms. If you are experiencing symptoms that you suspect may be related to herpes for the first time, it is important to see a doctor for proper diagnosis. They can also provide guidance and support during this initial stage. 2. Recurrent outbreaks causing significant discomfort. If you have been diagnosed with herpes and are experiencing recurrent outbreaks that are causing significant discomfort or interfering with your daily life, it is advisable to seek medical advice. Your doctor may recommend antiviral medications to help manage the frequency and severity of outbreaks. 3. Planning to start antiviral treatment. If you are considering starting antiviral treatment for herpes, it is best to consult a healthcare professional. They can assess your individual situation, discuss the benefits and potential side effects of medication, and guide you on the appropriate dosage. 7. The importance of getting tested. Getting tested for herpes is crucial for accurate diagnosis and appropriate management. Many people may be unaware that they have herpes, especially if they are asymptomatic or have mild symptoms. Testing not only helps identify the infection but also allows individuals to take necessary precautions to prevent transmission to others. It is understandable that some individuals may have concerns about the testing process and confidentiality. However, it is important to remember that healthcare professionals are bound by strict confidentiality guidelines. They are there to support and provide necessary care without judgment. 8. Managing herpes symptoms. While there is no cure for herpes, there are several ways to manage the symptoms and minimize discomfort during outbreaks. Here are some suggestions. 1. Taking antiviral medications as prescribed. Antiviral medications can help reduce the duration and severity of outbreaks. These medications work by inhibiting the replication of the virus, thereby speeding up the healing process. 2. Practicing good hygiene and avoiding triggers. Maintaining good hygiene is essential to prevent the spread of herpes and minimize the risk of secondary infections. Avoid touching or picking at the sores, wash hands frequently, and keep the affected area clean and dry. Additionally, it is important to identify and avoid triggers that can trigger outbreaks, such as stress, fatigue, or exposure to sunlight. 3. Using over-the-counter remedies for symptom relief. Over-the-counter remedies, such as topical creams or ointments, can provide temporary relief from pain, itching, and discomfort associated with herpes outbreaks. However, it is important to consult a healthcare professional before using any medications to ensure they are safe and effective for your specific situation. 6. Preventing herpes transmission. Preventing the transmission of herpes is crucial to protect yourself and your sexual partners. Here are some strategies to reduce the risk of transmission. A. Practicing safe sex. Consistently using condoms during sexual activity, including oral, anal, and vaginal sex, can significantly reduce the risk of herpes transmission. However, it is important to note that condoms do not provide 100% protection, as the virus can still be transmitted through skin-to-skin contact in areas not covered by condoms. B. Disclosure to partners. It is important to have open and honest conversations with sexual partners about your herpes status. This allows them to make informed decisions about their own sexual health and take necessary precautions. C. Avoiding sexual activity during outbreaks. To minimize the risk of transmission, it is advisable to avoid sexual activity during outbreaks when the virus is most likely to be present and contagious. This includes both oral and genital herpes outbreaks. Conclusion. In conclusion, understanding herpes symptoms is crucial for early diagnosis and effective management. Whether you experience visible symptoms or have silent herpes, seeking medical advice and getting tested are important steps towards accurate diagnosis and appropriate care. Remember, it is essential to consult a healthcare professional for personalized advice and treatment options. By managing outbreaks, practicing safe sex, and being open with sexual partners, individuals with herpes can live fulfilling and healthy lives. Let's continue to spread awareness and support those affected by herpes. Stay healthy, stay informed, and remember, you are not alone in this journey.